Now, your health, your safety. This is ABC7 News.
Hi there, I'm Kristen Z. Welcome to our daily special called Getting Answers. We're asking experts your question every day at 3 o'clock here to get answers for you in real time. Today, we have our special correspondent, Dr. Alok Patel, with us. So post your questions on our Facebook live stream, YouTube Live, or check out our Instagram stories to submit a question. And the show always continues online. We do not take breaks there. We're also keeping an eye on a virtual town hall happening soon with State Superintendent, the school superintendent, Tony Thurmond. He's expected to talk more about the current state of public schools. Now, Alameda, Contra Costa, Marin, San Mateo, Santa Clara, and San Francisco counties, the Bay Area counties, all said today that campuses will be closed through the rest of the school year. So that's June 2nd. Kids not going back this year. So when the conference starts, we will take you there live, virtually. But right now, let's get to your special correspondent and mine, Dr. Alok Patel. He is the original member in our coronavirus team of experts, and he is ready to answer your questions. Dr. Patel, thank you for joining us today. So much has happened since we last talked.
So much. It's evolving day by day.
It really is. So I'm really glad you're here to unpack some of it for us, because today, just in the past hour, I heard the CDC director say that U.S. coronavirus deaths could be much lower than the 200,000 predicted by some models that we were hearing a lot about last week. So what do you make of this?
What I make of that is that it's giving us proof that staying at home, sheltering in place, and the physical distancing could actually work, because a large majority of the country is doing it. Now, the caveat is we don't really know what's going to happen. It's just more this promise that we need to double down, and we need to keep staying at home, and we need to keep kind of flattening the curve as much as we can. And then we'll see what happens as we get more testing and as time continues.
All right, I want to also ask you, it seems like we're looking at a tale of two cities, or two states, I should say. New York is starting to hit its peak maximum number of deaths so far today. But here in California, Governor Newsom just mentioned at his 12 o'clock news conference that our curve has flattened, but that also means it's been lengthened. So I want to ask you, what does that mean?
Well, first, I have to commend Governor Newsom and every Californian for actually getting on top of the sheltering in place game way earlier than a lot of states did. I think it's made a huge difference here, and the numbers support that. Now, what people are saying when it comes to hitting the apex is that you're looking at the growth of cases day by day, which is how you can kind of predict the curve is slowly flattening. Now, what Governor Newsom meant when he said that it's lengthening out, that means that we may still see ongoing cases. It's just going to be spread out over time. And that literally is a way to describe the flattened peak. Because remember, we're trying to keep it underneath that max healthcare capacity. So even if it's lengthened out over time, but it's manageable, we'll be okay.
Okay. The video that we're showing right now, Dr. Patel, is a lot of people walking around locally in masks. Of course, that is something, you know, the recommendation really came out end of last week, and now we're all urged to be wearing masks all the time when we're out in public. How critical do you think that is in terms of the overall effort to prevent the spread?
Yeah, and the message is really going back and forth, and I think a lot of people are getting confused by that. But all the data that came out really showing us that there's airborne spread is what pushed the recommendation to go on. Now remember, the masks can be any type of cloth barrier, but it has to actually fit your face well. And it's more important for us to prevent getting other people sick, not necessarily preventing you from getting sick. And as always, the medical grade masks have to be reserved for frontline healthcare providers. For example, the N95. No one in the public needs to be wearing an N95. That's for people who are on the front line.
Absolutely. You've been sending that message, and I think it's still so critical to keep sharing that. I want to get to some of our viewers' questions. So I'm going to start with Regina, who asks, is it safe to wash my clothes in the community laundry room in my apartment building?
It's a great question, because a lot of people still have to go to community areas, whether they live in a building or at work. Now, one important thing to note is in a laundry room in your building, you're in an enclosed space. You have possibly limited ventilation, and so you can do your best to not be in there where there's other people in there, and perhaps the building is regulating that as well. But also, that's a really important indication to go ahead and wear a mask, you may be contagious with or without symptoms, and to also be really cognizant, be really aware of everything you're touching in that laundry room, the machine itself, detergent, whatever, the coin machine, whatever you may be using. So same rules apply.
All right, here is kind of a new one, but I've been seeing that in the past couple of days, and that is the transfer. And I don't want to get to gross anybody out, but I think it's important to ask whether there's any transmission through feces. And I've seen a lot of discussion about sewage as well.
I think the reason that question about feces and can we pass this in our stool, the reason that's coming up is studies have shown that some of the virus can be detected in our stool. Now, remember, that is the virus itself. That doesn't necessarily mean our stool is yet contagious. But I think the more important thing to address there is we have some of the receptors for the virus in our stomach. So people can present with nausea, diarrhea, and upset stomach and have COVID-19, not necessarily just the cold or flu symptoms.
All right. This one I think is also important, but I suspect the answer is kind of complicated, Dr. Patel, and that is Brenda asking, have they determined whether a person can get COVID-19 twice? You and I have talked a lot about the testing process, and I suspect we're not there yet with the testing to be able to answer that, can we? Whether you can get it twice?
Well, we can make a great scientific guess about this. And so the majority of people in the scientific community do believe that once you get it once, you will build some immunity against it. Now, the question remains is how long that immunity lasts? How effective is that immunity? Does it mean you're never going to get it again? Or does it mean that you'll get a weakened version of it? But it's important to understand that with any infection you get out there, any infection, your immune system is going to build antibodies against this. And those antibodies are literally designed for the same virus. So your immune system is more prepared to attack the virus if it sees it again. And this is the entire basis behind convalescent plasma and what the FDA hopes will be a really good treatment for people who are sick with this.
And that is the plasma of people who have recovered can be used to aid those who are currently suffering tremendously from COVID-19?
You nailed it. That's exactly what it is. The thought is by taking these antibodies from people who have recovered from this, who have purported immunity to this, you can give those antibodies to people who are sick in the hospital and who have symptoms and hopefully improve their course. There was a very small study looking at Chinese patients, and it showed some improvement. So now we're in clinical trials with this.
All right. What about the lag in testing? I wanted to address whether that's getting a lot better. Just on President Trump's news conference about a half hour ago, he mentioned that there are all these 5-minute tests now that are happening. But is that the reality of what we're facing here?
Well, I think a lot is a very general term because it really differs state by state. And even though we have tested our total number of tests is higher than other countries, we are not doing that well on tests per capita, on tests per person. And it's also important to note that when we give out the total number of tests, that doesn't tell us that's individual people being tested. If one person gets tested 3 times and somebody else gets tested once, that's 4 tests with 2 people. Now, President Trump is correct in saying that there's a variety of tests out there. There's a couple of tests which are point of care, meaning they can be done at the bedside. You can get a result in 3 to 5 hours. And there's others which basically may be able to take a few more hours, but there's still a massive backlog in testing, and we're seeing that across the country.
Right. All right, Dr. Patel, we're going to take a short break on air. But folks, if you're streaming, then the show never stops for you. We'll keep the questions going online. So join the conversation on Facebook Live, ABC7news.com, and on our news app right now.
The show continues.
The show continues. However, Dr. Alok Patel,
frozen?
we think that you need to reboot. Is that what we're saying, Mr. Director?
That is correct.
Man, yes, you kind of need to reboot. It's not great right now. So.
Yes.
All right.
Why is this app just the greatest?
All right, so Dr. Patel is going to take the time to do that right now while we take a break. But we want to send you over to Superintendent Tony Thurmond's virtual town hall. Let's listen.
For our students to be at school, and that threatens our health in many aspects. What is true, this is a challenge unlike we've never faced before. But as it relates to the education of California students, we must ensure that all of our students get a great education. As you know, we have entered into essentially the fourth week of our school campuses being closed to California kids so that we can honor the importance of social distancing that keeps our kids safe. But while our school campuses are closed to students, school is not out for this school year in California. We have been working with our students through distance learning. And by distance learning, I simply mean where the teacher and the student are in different locations. As an overview, around March 13th, our governor provided an executive order that provides our school district with all of the funding that they need to continue to support our students, that gives the flexibility in our calendar to ensure that our students can be served through distance learning. Those resources provided by the governor and provided by our state legislature also make sure that we can continue to support important functions that schools play for our kids, that our kids can get a meal at school. And in some cases, we have students who need 3 meals a day and get it through our free and reduced lunch programs.
All right, right now, this is the live virtual town hall by State School Superintendent Tony Thurmond, talking about the support that the school is lending to school districts, as it is now clear that there will be no school the rest of the school year through early June. Let's listen in for a little bit.
To all of our students, our parents and families, our educators, to everyone for your resilience, for continuing to go the effort that it takes to get through in these tough times. I know that it's not easy, but I believe that we can and that we will achieve in California. The California Department of Education has, since March 13th, provided guidance every week to California's 1,000 school districts to give guidance on how to do all the things that I've said, on distance learning, on providing meals, on childcare, on dealing with issues on how our employees work in our schools. And I'm proud of the efforts that my team, the California Department of Education, the governor's office, and many have played together to address how labor and management work together in our schools. We have to all be in for California students, and I'm proud of the framework that we've helped to create that guides the conversation for labor and management and how we serve our students. Every week, the California Department of Education will continue to provide training on how to provide distance learning. This is new for many of us, but not for all of us. This is the model that is taking place throughout all of our schools, not just in California, but for many throughout our country. We simply cannot give up on California kids. And I'm proud to tell you that we can ensure that California students will be able to graduate high school in spite of the challenges that we're facing on the campuses where students attend.
All right, this is a virtual town hall happening right now with State School Superintendent Tony Thurmond. Of course, he and the governor already announced last week, and now today joined by the 6 Bay Area counties in confirming that kids will not resume their school year this year. If you want to watch that, we're continuing to stream it on our web and on our news app, so you could watch that educational discussion there if you would like, talking about how the schools will ensure that students still learn during this time, relying on remote learning, and how they're going to support schools. And I want to bring back Dr. Patel because the school superintendent touched on a very important point, which is there's this socioeconomic divide in terms of who's still learning, right, with some wealthier school districts moving seamlessly into remote learning. But same with this virus, because today I'm hearing a lot about this racial and socioeconomic divide in terms of who's at higher risk when they do get COVID-19. And Dr. Patel, we were reading a lot about how African Americans, the numbers show so far, face a higher risk. Can you talk about what's driving that?
Oh, absolutely. I have to really quickly hit on the former point you made and say that, I'm glad to hear that people are paying attention to the disparity in our school systems, especially given that 30 million children depend on school for food and the education experience is totally different. So that has to be a priority of ours moving forward. Now, regarding African Americans, we are seeing some alarming numbers coming out. We're seeing in places like Illinois and Philadelphia a higher amount of cases in minority neighborhoods. And then the number that really struck people was coming out of Michigan, where they found that even though African Americans make up about 15% of the state's population, they're right now about 40% of the deaths from COVID-19. And so very alarming numbers. There's a lot of factors involved, one of which could be that African Americans tend to have a higher incidence of hypertension, diabetes, certain types of heart disease. But this also is really going to tap into socioeconomic topics like access to healthcare and testing. All this really plays a factor in getting the right care you need at the right time.
Absolutely. And these are important for, our government officials and public health officials to work together, and doctors such as yourself to address. All right, I want to ask about Linda's question on Facebook, because I'm seeing actually a lot of this. Stella's. It was reported that animals are getting COVID-19. There's been reports of people getting rid of their pets for fear they can get it from the animals. Can you please clear that up? And I'm asking this also because we saw over the weekend that there's a tiger that's now gotten COVID-19. But, with household pets, you don't want to see people just discarding their pets.
No, and first of all, that's heartbreaking and sad.
Yeah.
And, if people were afraid of getting a disease from their pets, they have to really ask themselves, are they protecting their pets when it comes to exposure? So that logic doesn't even make sense to me. Now, as far as we know, there have been no cases in the United States of an animal giving coronavirus to a human. We haven't seen that. Now, yes, the data coming out from the Bronx Zoo is showing that tiger getting infected has a lot of scientists, questioning things right now. But another thing that people are saying that's of note, these veterinary experts are saying, hey, it's really important to know that a big cat, a tiger, got this virus, and we aren't hearing reports of all these dogs and cats across America falling really ill. Because it's possible that the virus has a different effect depending on the animal it's in. So it really just comes down to us waiting to see how this plays out. But animals who Americans own, that's a part of our family, so you can treat them like any other part of your family and follow the same precautions, washing your hands and all that, and making sure your animals are still getting outside, but keeping them safe.
All right, absolutely. Here's another one. Does the TB vaccine, tuberculosis, does that help us protect against COVID-19?
As of now, there is no strong evidence to suggest that. There was a couple things circulating around the internet that were talking about the immune response, but I would not put any claim based on that. Our biggest priority right now is making sure we get a vaccine for this SARS-CoV-2, and we're in a trial right now, and hopefully we will have something about that. I will have a vaccine towards this in 12 to 18 months. All
right. Well, we certainly hope so. We have about 40 seconds left, but I want to ask you, those disinfectants, whether it's wipes or other products that say kills 99% of germs, number one, do they really? And then also, does that mean we're protected against COVID-19?
Not necessarily. So people have brought this topic up to me over and over again. They're like, hey, this is all natural. It's made with these oils. It says it kills everything. You have to look at the ingredients and verify using the CDC or the Environmental Protection Agency's website to look to see if those ingredients are actually going to kill SARS-CoV-2. Just because it says kills 99% of germs, it doesn't mean it kills SARS-CoV-2 or influenza or anything else we're worried about. So your best bet is to stick with what we know works. Either an alcohol-based cleaner, bleach, or something on those websites.
All right, good advice.
We actually found examples of this over the weekend.
Really? All right. Well, thank you so much.
We did. We found one very popular cleaner that doesn't work.
Okay. All right. You can tell me the brand afterwards. No, actually, thank you so much. We'll take this conversation onto Facebook now. We're going to take a short break on the air and check in with Dr. Patel on our streaming platforms. But the questions continue right now over there.
And we're in break.
All right. Which brand is it, Dr. Patel? All right, so
I'm probably going to get sued by them.
No, I'm just kidding. Let's not go ahead and talk about that. But I do want to ask one more question, and that's posed by Lawrence Chang. And I think this is really the million-dollar question. Why do some people survive the infection and others pass away from it? And, so far, the stories that you're hearing from the different people, I'm trying to connect the dots, and I'm sure all doctors are, but they're so hard to connect in this case.
It's a really complicated area right now, and what scientists suspect this has to do with is somebody's individual immune response to the virus. Now, some people's immune system is going to act exactly as it should. You're going to get a fever, which is a normal response. You're going to sneezing, body aches, etc. You're going to get rid of it. Other people are going to develop lung disease, and then their immune system is almost going to act in overdrive. And then they're going to get really severe respiratory distress. So it could be a difference in our immune systems. It could also be a difference in how many receptors your cell has for the virus. So there's a lot of hypotheses I've read about there, and a lot of public health experts are waiting to see how genetics plays into this, how our immune system plays into this, and how that all relates to age and pre-existing medical conditions.
Wow. All right. This is a long-term project for sure. But first of all, it sounds like we need a lot of data. And somebody's asking, Carol Schultz is asking, why can't we know how many cases are in our city as opposed to just our county numbers? We may have to take that question on the air because we're going back in 15 seconds. So hang on tight. All right, we are back with Dr. Alok Patel talking about COVID-19. And as we talk about the need for more data, right? I mean, if you're going to find solutions, you first need the data. And a lot of people are wondering, why do we only get the county numbers in terms of cases and deaths, but not broken down city by city? What do you think, Dr. Patel?
I think part of it has to do with reporting. And, it's difficult to actually report all the numbers, and you have to make sure that every single testing site is reporting not only the amount of positive tests, but the negative ones as well. So it really is a big coordination between different departments of health. It's not as simple as we will want it to be, but I agree with Carol. I think that's an important number to know.
Yeah.
Now, I'm just gonna move forward and talk about that new FDA test, the serology test. Our hope is to be able to have widespread testing, to be able to even identify people who have had COVID-19 in the past and have now recovered from it, so we can get a better sense of who out there is still at risk and how much of our community has seen it.
Yeah, can we even begin to estimate what percentage of the population has been exposed so far?
I mean, we have early estimates, and most of the estimates coming out are how much spread is still happening, and these are estimates based on the amount of positive tests, like we mentioned earlier with the curve. But with the serology test, with looking at people who have been exposed in the past, you can get a better sense for which groups are still at risk out there. And that's a really important number for us to understand.
Yeah, because that could determine, for example, whether you could go back to work, right, or work on the front lines. I have a friend who is convinced that she had it because she had all the symptoms and had never experienced anything like that before. But, she suffered through it on her own at home for like a few days. And she has never gotten tested and will never show up as a number.
Yeah, and I've heard the exact same thing from even some of my coworkers who are working on the front line and developed a fever and had these symptoms, self-quarantined, and weren't able to get a test in some areas. And they would love to know, did I actually have COVID-19? And if I did, number one, maybe I should be the one, going to the grocery store or going to work instead of somebody else. But also, this opens up the whole door to getting people to donate their plasma and donate those antibodies.
Yeah. All right, we got to get that kind of antibody testing on a widespread basis soon. In the meantime, I want to answer more of our Facebook friends' questions. Sandra is asking on Facebook, in our neighborhood, they do 2 street cleanings. Unfortunately, they don't use water, and it lifts the dirt very badly. I'm very uncomfortable with it, especially now. What can we do about it? Should she be uncomfortable?
I think it's fair to be worried about the dirt being lifted in the air if you have other respiratory conditions, if you have asthma, if you're sensitive to it. But I don't necessarily see a big difference regarding SARS-CoV-2. We do suspect it can live in the air, but remember that's going to be for a few hours. And so it's not likely that it was on the ground, then lifted in the air, and it was able to survive that long. And as long as people are still following the same precautions, we've already talked about masks, but all the personal hygiene, the risk shouldn't change that much from the type of street cleaning.
Okay, that's good to hear. Bella is asking, is it safe to keep your windows open? What if someone who has an open window next to yours coughs and then, passes it over to you? And I'm thinking, along with the new research that shows it could kind of hang in the air and travel longer and farther, maybe that's a worry. What do you think?
Well, I understand where the question is coming from, because when we say the word it can live in the air, everyone now is trying to put their own living space, their workspace into context with an airborne virus. But if I were to address that specific question, you have to think about where the window is, how close it is to another potentially open window? And then is the person on the other side of the window symptomatic? Are they coughing out the window? And I think what this question gets to is that we all have to really be doing our part. So if you were in that situation, you would have to be cognizant about who's near you if you're coughing. And that's why it's not up to just us, it's up to all of us working together.
That's right. All right. Christina asked, I've heard that blood type may play a part in the severity of the illness. What do you know about that?
There was a report looking at Chinese patients, and they were suspecting, what the report found was a slightly higher incidence in people with type A blood. Now, that wasn't definitive. It is not a large peer-reviewed study, so we can't make a claim off of it. What people are using that study to think about is if the difference in genetics affects how people are affected by this. Now remember, we have a lot of blood type variation in our population anyway, and so all this data will start to come in as we get more cases, but I wouldn't worry as much about the blood type. I would be more thinking about when scientists are going to get the answer about how genetics play a part. Because remember, genetics is related to the receptors, our immune system, our blood type, all of it.
Right. All right. How many seconds do we have left? All right. So we can get one more on here before we take a break, and that is, will heat kill the virus, such as summer? Now we have 15 seconds.
We have no data to suggest that. Other viruses tend to replicate or reproduce slower in summer months, but we just can't make that claim yet about SARS-CoV-2, unfortunately.
All right.
Still got to be vigilant in the summer.
Got it. All right, Dr. Patel, thanks so much. We're going to take another break on air and have a few more minutes with Dr. Patel on our live stream. So you can head over there if you like. We'll be right back.
And we're in break.
All right, we're in break. I want to talk about medications a little bit because someone I know had a friend who was prescribed hydroxychloroquine by their doctor because they were very sick with COVID-19. But they told a story of not being able to get it anywhere. And I want to ask you what you think is driving that and what's kind of the problem with that from a scientific standpoint.
Well, foremost, what's driving that is the false sense of security about hydroxychloroquine and azithromycin. Those are the two drugs in question. And, you know, everyone thinking that this might be a wonder drug or it might treat or prevent COVID-19. I'm hearing from pharmacists that they're getting excessive amounts of prescriptions from doctors, even from dentists, you know, trying to get this medication. And it's absolutely inappropriate. So, you know, 22 states have created restrictions about, you know, the prescription just to try to control the supply. Now, you know, hydroxychloroquine is crucial for people with some autoimmune diseases, such as lupus. It can prevent flares. You know, rheumatoid arthritis, it prevents flares as well. I would hate to see people suffering who have these diseases because it's being hoarded by other people. That's what we're trying to avoid.
Or people in clinical trials,
and that's why we need clinical
right?
trials to really understand.
Yeah, exactly. I was going to say, you also...
and a clinical trial is going to tell us... I'm sorry, go ahead.
No, go ahead. We have 30 seconds. Finish your thought.
We need to understand, is it safe? The side effects, the dosing, who gets it, who doesn't get it, how long do we use it? And that's all the information we would get from a quality clinical trial.
All right, Dr. Patel, always great chatting with you. I learn something new every time, and I certainly hope our Facebook friends and on-air viewers have as well. So thanks a lot. Let's keep the conversation going. See you soon.
Thank you.
All right, folks, going back on air. Bay Area and federal health officials are now encouraging all of us to use masks when we're out in public. So we asked ABC7 viewers to show us their face coverings by using the hashtag #MyMaskABC7. We're seeing lots of creativity with people designing and making their own. A fashion designer says to make it out of a fun fabric that you enjoy to wear. If you don't have sewing skills, there are a lot of YouTube videos showing you how, no sewing. The Centers for Disease Control also has tutorials on the proper way to make your own mask. Again, you can share yours with us by using the hashtag #MyMaskABC7. All right, that's going to do it for now. Thank you so much for joining us on this new interactive show, Getting Answers. We'll be here every day at 3 o'clock on air and on live stream answering your questions, right? Facebook Live, YouTube Live, ABC7news.com, and on our ABC7 News app. We're tracking questions that were not answered today, and of course, we'll save them for our next expert our next conversation, so feel free to join us every day here at 3 o'clock. World News Tonight is coming up next.